In this short video today, I want to talk to you about sort of Achilles and plantar fasciitis and just general sort of foot biomechanics as well. The foot is an incredible joint. It has 26 joints, 107 ligaments, 19 tendons, 20 muscles. There's an amazing amount of stuff that can go wrong with the foot. Now, in an ideal world, we should have a foot that has 3 big arches in there, transverse, longitudinal, and a transverse arch that basically gives us a shock absorber, so it allows us to sort of position the foot in the right place, but also make sure that the knee is in the right place as well. And by doing that, you have very relaxed muscles in your calves and in your hamstrings, but also in your hip, and that has a direct effect onto your back and into your neck. Professor Rothbert, a foot specialist, actually took some x-rays of people standing on barefoot. He then x-rayed their neck, he re-x-rayed the neck, changed the foot position, and the bones in the neck moved. The bones in the foot have a knock-on effect onto the neck. They affect everything in between. Now, patella is a muscle that sort of is formed as the calf muscle comes down here and then attaches into the back of the heel here, and it's called the patella. It's a tendon. Now, unfortunately, if the foot is not working properly, can you see how the ankle is going to be affected at the angle that it's going to hit the ground? So if the foot is not working properly, that is going to be having a knock-on effect onto the calf muscle, which is then going to aggravate and irritate the patella along here, and you can get something called patellar tendonitis. So it's not enough to just stretch and massage the calf and to work on the tendon. You have to look at the function of the foot. You have to make sure that the foot is working properly. So here at Bedford Chiropractic Clinic, we will be looking at the whole function of the foot to help you get rid of that patellar tendonitis that you may have. The other big problem that we can have in the foot is something called plantar fasciitis. Now, plantar fasciitis is this horrible sort of pain which is normally felt here at the base towards the back of the heel of the plantar part of the foot. And every time you stand up, especially in the mornings, when you get up in the mornings, it's very, very painful. When you've been sitting for a while and you get up and try and walk, again, it's very painful. Now, there is a reason for that, and the reason for that, again, comes to the biomechanics of the foot. If the foot has lost those arches, which unfortunately, in my experience over 19 years, 90% of people are flat-footed, they're pronating. That means then that this muscle, this fascia, that attaches from the heel all the way into your toes here, right, is stretched taut. So it's like sort of a very, very tight piece of cling film. And that then is being stretched out like this. It attaches to just at the base of the calcaneus here, and as with every step you take, it pulls, and you get this aggravated, inflamed, red, angry, painful spot here, and that's plantar fasciitis. Again, the way to treat that is to look at the biomechanics of the foot to make sure that the foot is working properly, and then obviously by correcting that, you're going to get rid of the pain. Here at Bedford Chiropractic Clinic, we are very, very geared towards looking at the reason that you are having these symptoms. And by treating the cause of these problems, we know that your problems will disappear and we can help you. So give us a call today, let's find out the cause, and let's help you.